For this module, we would focus on the other two areas of holistic healing, the mind and the soul, also known as the mental and the spiritual. We will discuss the following topics: the mind, or the mental causes of ED, including stress and anxiety, depression, post-traumatic stress disorder, or PTSD. Also, we will talk about the soul, or the spiritual causes of ED, including guilt and conflicts with your beliefs, values, ethics, religion, cultures, society. We also discuss about bad relationships and low self-esteem. We will also discuss how to cope with the mental causes of ED and how to manage the spiritual causes of ED. Stress and anxiety can impact erectile dysfunction and sexual well-being. Now, various factors such as issues within a marriage, family, finances, and job-related stress can contribute to feelings of worry and anxiety about performance and the ability to obtain an erection. Now, stress and anxiety can manifest into physical symptoms, including nervousness, irritability, chest pain, and mood swings. These psychological and physical symptoms can disrupt brain signals and impair blood flow to the penis, which leads to difficulties in achieving or maintaining an erection. Additionally, stress and anxiety can decrease sex drive and desire and lower testosterone levels. It is important to recognize that stress and anxiety can affect individuals of all ages, both young and old. Now, addressing and managing stress levels and anxiety levels is crucial for promoting healthy sexual function and overall well-being. Depression can have a significant impact on sexual desire, arousal, and overall sexual function. Now, individuals going through depression may experience a decrease in sexual desire and find it challenging to become aroused. Depression can also lead to increased levels of cortisol, a stress hormone. Now, elevated cortisol levels can constrict blood vessels, including the vessels in the penis, thus potentially contributing to ED. It is worth noting that certain antidepressant medication commonly used for depression may also contribute to ED as a side effect. Now, these medications can affect various aspects of sexual function, including desire, arousal, and the ability to maintain an erection. Depression and ED often coexist, and it can be challenging to determine which condition came first. They can interact and exacerbate each other, creating a cycle where depression contributes to ED, and then ED further worsens depressive symptoms. Post-traumatic stress disorder, or PTSD, and erectile dysfunction can be interconnected, particularly in individuals who have experienced traumatic events. Now, studies have indicated that military veterans have a higher incidence of ED compared to the general population. Now, traumatic events such as death, disaster, injury, assault, or accidents can trigger PTSD in individuals. Now, traumatic memories can induce a fight or flight response in the body, leading to increased release of cortisol, a stress hormone. As previously mentioned, elevated cortisol levels can constrict blood vessels, including those in the penis, potentially contributing to ED. And furthermore, PTSD can increase anxiety levels, which can have a negative impact on sexual function and contribute to ED. Feelings of guilt and conflicts surrounding personal reasons, such as conflicts with beliefs, values, ethics, religion, culture, and society, they can all have a significant impact on erectile dysfunction. When individuals experience negative emotions or unresolved conflicts related to sex, it can hinder arousal and sex drive and ultimately contribute to difficulties in achieving and maintaining an erection. In addition to affecting sexual function, these conflicts can also increase anxiety and depression. Guilt arising from conflicts about sexual behaviors or desires can create psychological barriers that interfere with sexual function. The internalized guilt can lead to a sense of shame and also inhibit sexual desire, arousal, and overall sexual satisfaction. Now, these conflicts may stem from personal beliefs and values, societal expectations, cultural norms, or religious teachings. Bad relationships. Negative past or current relationships can have a significant impact on ED. Now, these relationships can create stress as well as cause tension and distance between partners, which can contribute to performance anxiety and difficulties in achieving and maintaining an erection. Now, unhealthy relationships marked by conflicts, lack of trust, or poor communication, they can all lead to increased stress levels. This chronic stress can disrupt the body's natural sexual response and interfere with the ability to perform sexually. Now, the lack of unity and togetherness in a relationship, which is crucial for healthy sexual connection, can increase the challenges associated with ED. Emotional disconnection, resentment, or unresolved issues can hinder the intimacy and openness necessary for satisfying sexual experiences, all contributing to ED. Low self-esteem can be closely linked to ED. Individuals with low self-esteem may experience feelings of inadequacy and shame related to their ability to perform sexually, which can increase performance anxiety and contribute to ED. Now, the interplay between low self-esteem and ED can create a self-perpetuating cycle. ED can further erode self-esteem as it can be seen as a personal failure, leading to even lower self-esteem. What can one do to overcome mental causes of ED? For mental causes of ED, such as stress, anxiety, depression, and PTSD, various relaxation techniques and therapeutic approaches can be beneficial. Relaxation techniques, including meditation, yoga, breathing exercises, and guided imagery, can help alleviate stress and anxiety. These practices promote a sense of calm, reduce muscle tension, and enhance overall well-being, which can positively impact sexual function. Psychotherapy and counseling are valuable resources for addressing the underlying psychological factors contributing to ED. Therapists can provide support, guidance, and specialized techniques to help individuals manage stress, anxiety, depression, and trauma-related symptoms. Through therapy, individuals can explore and resolve emotional challenges, develop coping strategies, and improve self-esteem and self-confidence, which can positively impact positive sexual health. Addressing the spiritual causes of erectile dysfunction, including guilt conflicts, bad relationships, and low self-esteem, they all involve recognizing the underlying factors and seeking appropriate support. To address guilt and conflicts, it is important to identify the specific factors causing these negative emotions. Evaluating one's beliefs, values, ethics, religion, and culture can help in finding ways to reconcile these factors with one's healthy sexuality. Seeking peace and acceptance with these factors can contribute to a more aligned and positive approach to sexual well-being. It may require counseling from trained professionals to help one identify these factors and align them with their sexuality. In overcoming bad and negative relationships, both past and present, it's crucial in addressing their impact on ED. Therapy through individual and couples therapists can provide a safe and supportive environment to work through relationship challenges and develop healthier dynamics. Addressing low self esteem involves finding ways to build self confidence and self acceptance. Now, therapy and counseling can help individuals explore the underlying causes of low self esteem, challenge negative beliefs, and develop strategies for building a positive self image, all to provide valuable guidance and support towards spiritual and sexual well being. In summary, review the mental causes of your ED, review the spiritual causes of your ED, evaluate what items apply to you. Then ask yourself, what can you do to implement mental and spiritual changes and improve your erections? In the next module, we will discuss natural supplements to support erectile functioning, including nitric oxide boosting supplements, phosphodiesterase type 5 or PDE5 inhibitor supplements, and other supplements.